Hi guys, Dr. Alistair McAlpine here, and today I want to talk about an interesting topic. It's quite popular in social media. Every second influencer is talking about it, and that is perimenopause. So it's obviously getting a lot of traction because it's affecting a huge number of people. So perimenopause basically is this transition that female patients experience just before menopause. So it's a time that is filled with great uncertainty because symptoms can be quite rapid in terms of onset. Patients don't really know what's going on with themselves, and they're sometimes unaware of what the problem is. And there's a lot of unanswered questions when it comes to how do you actually manage perimenopause. It's a bit of a gray zone because it's not a one-size-fits-all approach. So today I want to cover basically what is perimenopause, some of the symptoms of perimenopause, and then how we can manage this as well. If you find this video useful, please like, subscribe, and share with friends or family that you feel may benefit from this information. So let's get to it. So what is perimenopause? So basically perimenopause typically begins for most patients in their 40s, sometimes can be earlier, even patients in their mid-30s. And this obviously normally lasts until menopause, so peri meaning prior to menopause. So basically what happens during this transition is that the ovaries basically gradually reduce production of estrogen and progesterone as well. So this now creates a very different hormonal profile, and you find that it creates what we term a hormonal roller coaster. So patients feel that they've got symptoms that are all over the show because now that hormonal profile that was in balance now becomes unbalanced, which is going to cause a whole bunch of symptoms as well. So what's also important to mention here, it's not just about estrogen and progesterone. It's also about other hormones like testosterone. So we also notice in these patients they get quite a significant drop in their testosterone levels, which further adds more fuel to the fire when it comes to symptoms or presenting symptoms. Also, cortisol can be affected as well, and insulin, which also has quite a significant downstream effect. So you find that it's not just this hormonal profile is now shifting as well, but because it's not like a perfect storm that's being created, hormones are now imbalanced, lifestyle factors now change purely because you find energy levels are not there, motivation's not there, depression starts to kick in, bit of brain fog. There's all these symptoms that basically all compound one on top of the other, which changes these patients in terms of the way they feel that they can function on a daily basis. So when you look at the symptoms of perimenopause, what are we looking out for? So common ones are start of hot flushes and night sweats. That's one of the first symptoms that normally occurs. Patients start to notice irregular or heavy periods. So they're not as regular as they used to be, and notice that sometimes they bleed a lot more, so period is considerably heavier. They also complain a bit about brain fog and sometimes memory lapses, so become a little bit forgetful. One of the big draw cards or big symptoms that patients also experience is mood swings, anxiety, depression. They find they become highly irritable. They can become very short and snappy with family members and loved ones, and they can't explain why they feel like this. Sleep disruptions also another big symptom as well. And then one of the biggest factors as well that also drives patients to seek medical attention for this is weight gain. Patients are doing exactly what they normally did. Same diet, exercising the same, nothing's changed, but all of a sudden they're putting on weight and they don't know why. And one of the big things that also happens is changes in skin and hair health. So patients start to notice thinning of hair, the skin is not as healthy as it used to be, thinning of the skin, increased laxity of the skin as well. And then also libido, sexual health also takes a bit of a dive as well. So patients find that sexual drive is just not there, struggling in the bedroom. So as you can see, there's a myriad of symptoms that basically make up perimenopause. Not all of them happen together. Sometimes happen as staggered effects. Some patients don't get certain symptoms. But if you're experiencing these type of symptoms, it would be worthwhile investigating why am I experiencing this, because you may be in the early stages of perimenopause. So a lot of women have told this is just part of aging and you're just going to have to get over it. But These can be addressed. Perimenopause can be managed effectively, but it has to be very patient-centric. So what do I mean by that? It's not a one-size-fits-all approach. So what are the modern approaches now to managing perimenopause? So top of the list is hormone optimization. And what do I mean by hormone optimization? Ideally, the use of bioidentical hormone replacement therapy. The reason for this is highly customizable and extremely safe as well. Doesn't increase the risk of cancer, doesn't increase the risk of blood clots or cardiovascular issues, and you can tweak these medications basically how and you feel that you need to based on blood results to make it very, very patient-centric, so specific for that patient that you're treating. So it's not just writing a prescription and going off to the pharmacy and getting a tablet. You are making sure that you're customizing the therapy to suit the patient's blood results, symptoms, and medical history as well. So this is where bioidentical hormone therapy is key to starting managing of perimenopausal symptoms. We then talked earlier about weight gain and insulin shifts as well. So basically, the start of almost like a insulin resistance type picture. The patients are struggling now with their weight. So this is when GLP-1 receptor agonists come into play. So medications like semaglutide. So weight gain is probably one of the most frustrating aspects for these patients. As I said, their diet's the same, they're training the same way, but they just can't seem to shift weight. They just keep on gaining weight. So semaglutide, once again, done with medical guidance and done correctly, can be highly, highly, highly beneficial. So it's almost starting to use these medications before it's too late as well. So a microdosing approach works really, really well as well. But as I say, done under medical guidance. And there's also other benefits to using these GLP-1 medications as well, is that improving cardiovascular health, improving metabolic health, you're decreasing inflammation as well. So it's not just about weight as well. It's all the other downstream effects that these medications have that can be beneficial from a longevity point of view and with managing the symptoms of perimenopause. Another medication that I'm a big fan of when it comes to perimenopausal management is NAD. So nicotinamide adenine dinucleotide. I know it sounds like a mouthful, but you'll hear about NAD everywhere. It's basically like the new collagen. Everyone's talking about NAD. So basically, NAD is a coenzyme that works on a molecular level that is going to improve health of mitochondria, which then slows down the aging process. But not only does it help with slowing down the aging process, it also helps to improve the fatigue, can also help with the brain fog, and you find that patients just feel more revitalized using this supplement as well. So this is where the combination of bioidentical hormones with the GLP-1 receptor agonist with NAD is a great combination to use for the management of perimenopause and perimenopausal symptoms. Once again, what's very important to reiterate is this needs to be done correctly. It needs to be done with blood work. It needs to be done under medical guidance to ensure that it's being customized and personalized for you as a patient. Can't be a one-size-fits-all approach. So we've obviously looked at sort of the pharmacological interventions that we can use for perimenopause, but now what about more holistic approaches? So you now obviously addressed the pharmacological side. What else can I use to make the outcome even better for patients? So this is where nutritional advice, so use or from a dietitian or clinical nutritionist to make sure you got your nutrition on point, and obviously exercise as well. Weight training, resistance training, been shown to be massively beneficial for patients experiencing perimenopause or perimenopausal symptoms. Why? Because increasing muscle mass or just even maintaining muscle mass is going to have a significant effect on your metabolic system, which is obviously going to help with a lot of the symptoms as well. So looking at a complete holistic strategy, pharmacological intervention, so bioidentical hormones, GLP-1 receptor agonists like semaglutide, NAD, then adding nutritional advice, nutritional support, and exercise, particularly resistance exercise. So in closing, I just want to say perimenopause does not have to be a period of decline. It's important to recognize these symptoms early, especially before you hit menopause. If you recognize these symptoms early and you treat it early, you basically can mitigate a whole bunch of downstream effects further down the line. So if we look at patients that when they go from perimenopausal state to a menopausal state, the downstream effects that we have in terms of decline in cognitive health, decline in muscle mass, degradation of cardiovascular system, all these important physiological systems that have now been basically damaged during that perimenopausal phase. When you hit menopause, now becomes a problem. Another one to include there as well is osteoporosis as well. Because why? Loss of muscle mass, decreased testosterone, decreased estrogen. These are all factors that are going to decrease lifespan and health span. So once again, going through those symptoms of perimenopause, if you're experiencing any of those, reach out, get some blood work done, get the correct medical guidance, and don't wait until it's too late. Anyway, I hope you found this video to be helpful and informative. Please like, subscribe, and share. And I look forward to the next video and hope to chat to you guys soon. And any comments or any questions, please just pop in the comments below. I'll get back to you as soon as possible. Anyway, hope you have found this to be informative, and we'll chat to you guys soon.